According to the International Osteoporosis Foundation, every year all over the world, osteoporosis causes more than 8.9 million fractures. Now, this translates to one osteoporotic fracture every 3 seconds. Now, these fractures will be experienced by 1 in 3 women over the age of 50, as will 1 in 5 men over the age of 50. Now, in South Africa, 1 in 3 women and 1 in 5 men will possibly develop this disease within their lifetime, which means potentially that between 4 and 6 million South Africans suffer from osteoporosis. So the questions you might be asking yourselves are, what causes osteoporosis? How do these fractures actually happen? How can they be prevented? Is osteoporosis curable? Well, stay tuned, because this is what we'll address in today's show. World Osteoporosis Day is celebrated annually on the 20th of October. So today we've decided to tackle the topic of osteoporosis. We'll be joined in studio by a specialist physician and expert on osteoporosis from the Wits Donald Gordon Medical Center. And joining us from our Cape Town studio is the CEO of the National Osteoporosis Foundation of South Africa. Now, as always, I invite you to be part of the show by asking the panel some questions or simply just sharing your views with us. The number to call is Johannesburg 714-5861 or 5877. You can also tweet us at SABC Health Talk or simply interact with us on our Facebook page, SABC Health Talk. Sit back, relax, and learn from this bumper show coming to you just after a short break. I'm Dr. Selomit Daoum, and this is Health Talk.
The SABC News mobile app is your one-stop digital portal to all the news you need. Stay connected with the latest in breaking news. Watch the SABC News channel along with clips and live streams of all the big news events. And listen to all the SABC News radio stations live, including podcasts and much more. Simply download the SABC News app to your Android or iOS device from either the Play Store or the App Store. SABC News, independent, impartial.
Here we are witnessing in Harare the beginning of the end of the apartheid system.
I'm insisting that with regard to all of these strategic interventions which made the 1994 democratic victory possible, we had Oliver Tambo as a decisive, leading and defining player.
They are sitting back because they're afraid that they won't be re-elected. They should not be re-elected.
Trish Clayton, 59 years of age, mother of 4 boys, has been recently diagnosed with a condition called osteoporosis, but says she has been living with it without knowing.
I started breaking a lot of ribs about 12 years ago. I went through a stage when I broke quite a few ribs, and I spoke to my GP and I said to her, what did she think if I had osteoporosis? And she said it was likely. But at that stage, I didn't bother about it.
Trish was concerned about her injuries and she started to do research about it, and only then she found out she might have osteoporosis.
Since we've been living here in this area, in Lanseria, it's pretty. I've suddenly had a problem insofar as I smacked my hand against a wall and I broke a knuckle. Apparently I need a knuckle replacement. A couple of months back, I sort of stumbled back against the windowsill and broke another rib. That's 8 ribs now in total. And I started waking up at night with a pain in my left hip. So I thought that it was time that I had a look. And so I did a little bit of research, and I was horrified to see how serious the disease actually is and how many of the symptoms I actually had.
Osteoporosis is said to affect women more than men. And according to Trish, her doctor insinuated that her condition might be due to her lifestyle.
When I spoke to my doctor initially, 12 years ago, whatever, she actually said to me that I fit the profile: blonde, blue eyes, thin, smoking and drinking. They're big things. I had a very social job, so my job was visiting pubs at night and that sort of thing. I was an entertainment agent. So smoking and drinking was quite a big thing in my life, and that obviously must have contributed.
The risk of osteoporosis is higher in people who have certain health conditions, and Trish is also living with a condition similar to Parkinson's disease.
I do have an essential tremor. You'll see my head is shaking a bit, which is also incurable, but it's not life-threatening. But it makes me, I have bad balance. So I easily lose my balance, and that is scary with osteoporosis. I'm really scared that I can fall more often than most people.
Living with osteoporosis can limit one's level of activeness, and this has frustrated Trish for a long time.
Very big difference in my life before and after. Now it's a problem. I hardly go out. The pain stops me from doing a lot of things. When I do have to go out, I can't stand and just be out for a full day. But by that stage, the pain is quite severe.
She still hasn't seen a specialist for her condition due to lack of funds, but Trish is on prescription medication prescribed by her GP.
And she will prescribe a drug. There are drugs that apparently arrest the condition, the disease. I'm not sure whether I can afford it, but I'll have to make a plan.
Osteoporosis is usually associated with older people, which makes people not pay attention to it. Trish went on to search if there could be help or other people living with it.
Didn't know what to do about it, so I joined a couple of Facebook groups, and I didn't have a clue what they were talking about, the medications they were talking about, the various things they did. So I contacted NOFSA, I emailed them, thought I'd get some information from the horse's mouth, and they were fantastic.
Organizations such as the National Osteoporosis Foundation was set up to help people like Trish, and the aim is to give support for people who lack knowledge.
All right, so to learn more about this condition called osteoporosis, it's a great pleasure to welcome our guests. First up in our Johannesburg studio here is Dr. Haley de Wit, who's an osteoporosis specialist and is a specialist physician based at the Donald Gordon Medical Center out here in Johannesburg. Welcome to Health Talk, Dr. de Wit.
Thank you, Selo. Great to be here.
Oh, great stuff. Now, in our Cape Town studio, we also have another special guest, Teresa Ho, who's the CEO of the National Osteoporosis Foundation of South Africa. Teresa, welcome to Health Talk.
Thank you, Selo. Morning.
All right. We're going to come back to you in a moment. I just want to start with Dr. de Wit here. Let's start from the beginning and define exactly what it is we're talking about here. Osteoporosis. What is it? And some people might actually even confuse it with arthritis. What is osteoporosis?
Yes, often it can be confused with arthritis, but osteoporosis is a separate condition. The word osteoporosis actually means a porous bone. So really what it is it's a condition that causes a weak bone where you lose your mineral density of your bone, you lose your integrity, your inside architecture and scaffolding that actually gives the bone its strength.
Right.
And you are then more vulnerable with a weaker bone that is vulnerable to fractures or breaks with minor bumps or injuries.
Okay. So in my introduction, I mean, I quoted some statistics about
yes.
1 in 5 women and at least, 1 in 3 women and 1 in 5 men and so on. How common is it in South Africa?
It's common, and the problem is, I think, it's something that flies under the radar and that people are not aware of, and it's not given the airtime that it deserves.
Right.
But it is common, and it falls in with the global trends that you did quote. And unfortunately, because it's a silent disease, until you actually suffer from one of the complications, the fractures, you don't know about it.
Right. So you described it as this, brittle bone, as it were. How does it actually happen?
Well, our
So perhaps
bones,
before you could take us through what happens in normal bone, to
Yes.
give it its normal strength and compare that to...
So we build our bones as we're growing and teenagers, and by our early 20s we formed what we call our peak bone mass or our peak skeleton. And then your bone and your skeleton, it's a living thing, so it has to continue regenerating and looking after itself. And there's quite a delicate balance in this, where you resorb old bone and you replace it with new fresh bone. And you need to keep this balance in order to maintain your peak bone or your bone mineral density. What happens, unfortunately, with aging and with all these other things that we'll discuss or that have been mentioned with Trish, is you get an imbalance where you often start to lose more bone, or you're not forming as much new bone as you should, and sometimes it's even both that are happening. And as a net result, you land up with less bone than you should and a weaker, more fragile bone.
Okay, all right. And I suppose that's how the fractures come in, but we'll come back to that. Let's cross over to Cape Town and speak to Teresa. Teresa, you're the CEO of the National Osteoporosis Foundation of South Africa. Perhaps you might just want to tell us a little bit about what your foundation does.
Well, we're a dual foundation, so we raise awareness amongst patients and the public, and also educate doctors on the prevalence and just about osteoporosis.
Yeah.
Trish was a very special patient that we spoke to a few weeks ago.
Right.
And I must say, once I hear her story and the fact that she actually thinks NOFSA is fantastic, it makes it worthwhile to fight for osteoporosis rights.
Right.
Because osteoporosis is one of the orphan diseases. It's what I call it a Cinderella disease.
Right.
It doesn't have the sexy factor that something like cancer or AIDS have. So as Hayley said, it flies under the radar, and we just do not get enough attention about this very silent disease.
So you mentioned
AIDS, people with AIDS get osteoporosis. There are so many of the chronic diseases that get enough noise that cause osteoporosis in the end.
Yeah.
So that's why we have to keep on fighting to lobby for patient rights, because osteoporosis is not a prescribed minimum benefit on medical aids. And really, patients like Trish need medication, and she can't afford it, and that's basically why we're there. We need to fight for the patients.
So you mentioned you teach even doctors about osteoporosis more than just the public. How much is known about osteoporosis?
Sorry, Celia, I didn't hear that question.
I was just saying that how much is known about osteoporosis? Do people know a lot about it? I mean, you mentioned the fact that you even teach doctors about the condition.
Yeah, you know that teaching doctors is a hard ask about osteoporosis. I'm only joking. I think it is a silent disease. So people just don't pay enough attention to osteoporosis. And doctors, we have a training course for doctors every year, but there's just too little known by doctors about osteoporosis, because we get many patients who phone the foundation and say, "Oh, my doctor said it's way too late for us to do anything about your bones. You just please don't fall because you have the bones of an 85-year-old." So I think educating doctors and just telling them that much can be done to prevent fractures, even if you have a patient with osteoporosis.
Yeah.
And I think Dr. Google, as all of us know, I want to shoot Dr. Google sometimes because patients go to Dr. Google.
Yeah.
And then they get all the wrong information. So I think that's why we're a dual foundation. We need to educate patients and doctors.
All right. Okay, let's come back to Dr. Hayley here. Talk about if we can, clinical signs and symptoms, and perhaps how you actually diagnose this condition.
Okay, so as it's been mentioned again and again, it's a silent condition. So often you know nothing about it, as Trish said, until you start to break bones. So it's a gradual, insidious process of losing your bone density or your bones thinning, and you have no idea.
Yeah.
But that's why it's important to know if you've got certain risk factors so that we can actively screen for it, and you know if you're at an increased risk of it.
So why does it affect more women than men?
Well, with women and menopause, the menopausal process, and when they lose their estrogen, that causes an imbalance in what I spoke about earlier, where you're losing and forming bone. And so you start to lose more bone than you form. And so we see it more commonly than in women. Also, just by the nature of a woman's skeletal build, they are more petite, so just by the geometry of their bones, they start off with less bone than a man does.
Yeah, but
it
men
does affect
certainly
men.
do have osteoporosis.
They do.
All right. So let's then talk about the clinical course. Let's say somebody, and I mean, we mentioned the issue of the age, that
Yes.
it's seen more commonly in people over the age of 50. Do you see it any?
Well, age is the greatest risk factor really for
Yeah.
osteoporosis and
Right.
fracture.
Right.
And it's most commonly after the age of 60, which generally is most women have menopaused by
Yeah.
then, but it is over the age of 50 that they talk about.
Yeah.
And it's just as you get older, obviously this process continues, so your bones are thinner and you are at more risk.
Okay. And the complications, I mean, before we talk about that, let's take Peggy on the line from Soweto. Peggy, welcome. Peggy, are you there?
Yes, I'm there. How are you?
We're good. How are you, Peggy?
I'm fine. Thanks for asking.
You have a question for
Yes.
us?
Yes, please. I just wanted to find out, I'm a 42-year-old female.
Right.
I've consulted my GP 2 years ago
Right.
and was diagnosed with mild osteoporosis.
Okay.
And I went to get what do you call this, the scans,
Yes.
and the results were the same. Yes, I do have mild osteoporosis.
Right. So what do you want to know?
I just want to find out that because as an athlete, osteoporosis will affect my effective on because I'm a comrade runner. I'm into sports.
Right.
So currently I'm only using the Caltrate Plus, which is for me to my bones to be stronger. So I just wanted to find out from the doctor there what can be done, maybe, and what is the outcome? Will I be healed on this?
Okay.
And the last question, my mom, I was told that you can inherit this because my mom passed away and she had an osteoporosis as well.
Okay. All right. Okay. Two excellent questions. Thank you very much for those. Just stay tuned and we'll try and answer the questions. Perhaps let's deal with the first one, and we'll try and deal with the second one after the break. Okay.
Okay.
The issue around the clinical course. Ultimately, what happens? Is osteoporosis curable, or what actually happens?
Well, osteoporosis, it is curable if you catch it when it's mild, and there is a certain amount of reversibility. But when we talk about osteoporosis, and why we talk about it is because of fracture. So we're trying to prevent fracture. So we're not specifically looking at curing the bone density numbers that we're receiving. We are trying to take the patient from being at high risk of a fracture to low risk. So bringing them back to a normal risk of breaking a bone.
All right. Okay. We'll try and address some of the questions, or at least the second part of the question after the break. But for now, we're going to just go through a tweet that has just come through. Laura says, my grandma was not crying in the bathroom at 3 a.m. for attention. She's not imagining pain because mom went on holiday for a week. She has osteoporosis and a fractured pelvis. It hurts. She probably needs a better pain management plan. Oh, shame. All right. On that note, that we go for a quick break. When we come back, we continue our story on osteoporosis and try and understand what causes osteoporosis or who's at risk of developing this condition. Please stay with us.
Many
Many often share their worry about artificial intelligence taking their jobs away. The truth of the matter is that artificial intelligence does a lot of things faster and better than humans.
That machine didn't make itself, it was made by a human being. So which means us as human beings, we need to think more on the skills which we have.
I feel like ultimately it'll increase productivity and efficiency of things.
There's a lot of apprehension from the staff. The staff is really worried, what's going to happen, am I going to lose my job? Is machines going to take over the world? The reality of the matter is though that the future is a blend of humans.
I don't like the sound of it too much. The fourth industrial,
On network every Sunday at 8:30 p.m. 1.75 million was paid to you on the 14th of March 2018. What's your response to that?
How do these comments add to this narrative?
It only takes 1 minute to change your mind.
This money has to be paid back. The bottom line is, who is held accountable? Water consumed by residents is not suitable for human consumption. What's going on there?
Why haven't we seen solutions to these problems?
The women and the children of this great country are under siege.
I can hear the cries of women in the streets.
Women are dying with protection orders in their homes.
Women face the onslaught of an oppressor with a different face.
The scourge of violence against women is a dark stain in our nation.
I stand here today and I think of Valencia Farmer. I think of Uyinene. I think of Jesse Hess.
There must be harsher punishment for rape.
We've been mourning, we've been sympathizing with the women that were raped in our country.
Gender-based violence has reached extreme levels which can no longer be tolerated.
Don't strike your sisters. They are the mothers of tomorrow.
Our mothers have cried, our sisters have cried, our daughters have cried, and we are saying enough is enough.
Welcome to Media Monitor. This is where we take a look inside the world of media, analysing the trends and the issues and the reporting of some of the week's top stories. A shocking report states that 51% of South Africans don't trust the news.
The trust levels in independent media have also come from media getting it wrong very often.
Does this mean that our journalists are not credible enough?
We got investigating journalists in South Africa, the best.
Welcome back. We're talking about osteoporosis with our guest, Dr. Haley de Wit, from the Wits Donald Gordon Medical Center, and in our Cape Town studio, Teresa Ho, who's CEO of the Osteoporosis Foundation of South Africa. We're going to come back to Teresa, but let's just come back to that issue, Dr. de Wit, of that question that we had. First of all, and I think it links to what exactly we're talking about, who's at risk of developing osteoporosis? Are there hereditary factors? She's asked about the fact that her mum had osteoporosis, and
So that is one of our strong non-modifiable risk factors, if I can put it that way. Yeah. You can't do anything about your genes, but it's important to know, because if you have a first-degree relative who has suffered from a fracture, that is a significant risk for you to have a fracture, and just having osteoporosis in a first-degree relative makes it more likely in yourself.
All right. Well, okay, so let's talk about modifiable risk factors then, or perhaps some of them may not be.
Yeah.
I'm just getting back to her original
Peggy,
question.
yes.
She's young, she's an athlete, she's a runner, she's not overweight, we can assume, and yet she developed osteoporosis.
Okay, so her age is the one thing that is on her side. As I said, when we look at osteoporosis, we're actually looking at fracture risk, and just by the nature of being younger, your risk is lower. However, we do worry with our marathon runners or our those kinds of athletes, sometimes your body mass index or your weight can be low. And if you do have a low BMI, low body mass index, that can predispose you to osteoporosis, especially if it affects you in such a way that you are not producing enough estrogen and you become amenorrheic. So is she still having her periods? Has she gone into an early menopause? Is she amenorrheic? As we discussed, estrogen is important for bone formation. So that's important. And also nutrition, just to know that you've got enough on board for what you're using. Otherwise, you cannot be anabolic and build.
In fact, the nutrition part is what we need to spend a bit of time on. But before that, let's take Bongiwa on the line from the Val. Bongiwa, welcome.
Good morning, sir.
Morning, Bongiwa.
I'm a 61-year-old lady from Vanderbilt Park.
Right.
I started suffering from rheumatoid arthritis.
Right.
And I had to stop working at 51 because it became worse. Now I see that you are speaking about osteo, not rheumatoid.
Right.
But I want to know the difference because I think it's affecting the bones.
Okay.
Both.
All right. Good, very good question.
Yes.
Do you want to just perhaps tackle that? The difference between, well, I mean, rheumatoid arthritis she has, and perhaps you can just say if there is any link or risk factor.
So generally, first just to say the difference between all arthritis and osteoporosis. Arthritis is something that usually affects more the joint surfaces around the bones. With osteoporosis, we're actually looking at the integrity of the bone and the inner side of the bone, two separate entities completely. However, with rheumatoid arthritis, which is different to your osteoarthritis, just so that people don't get confused, which is the more common one that people get as they grow older. With rheumatoid, it's one of our autoimmune inflammatory conditions. And unfortunately, with most of the inflammatory conditions, they do predispose to an increase in your bone turnover where you lose more bone. And so you can often, if you have rheumatoid arthritis, also get osteoporosis, or at least there is then a predisposition. The other problem is also with the inflammatory conditions like rheumatoid arthritis, they're often treated with therapies like cortisone.
She's 61 years old. What should she do?
So she should definitely be screened.
Okay.
She's at high risk and needs to be screened.
All right. Let's cross over to Teresa. Teresa, you know, we saw that clip earlier. We're talking here about obviously risk factors for osteoporosis. And Trish said that, you know, she's a typical candidate, as it were. You know, thin, blue-eyed. Does the color of eyes have anything to do with osteoporosis?
I think that was just an interesting fact that they saw at one or other stage. But yes, it was always thought that thin, blonde, blue-eyed ladies got osteoporosis. But it doesn't. It's not a strong risk factor for osteoporosis. No.
Right. Perhaps you want to just comment on some other lifestyle-related risk factors for osteoporosis.
Well, she mentioned smoking, and smoking obviously suppresses the estrogen levels in women, and it's also a big risk factor for osteoporosis in men because it suppresses their testosterone. Alcohol, we live in a country where alcohol abuse is rife, so we try and tell our patients to keep their alcohol intake to 2 and less alcoholic drinks per day. Vitamin D is also a very, very important risk factor because I think there's a global deficiency in vitamin D levels, and we can talk about that later. We've become sedentary. Our kids sit in front of TVs, we sit in front of computers, so lifestyle has become increasingly bad, and like for most of the other chronic diseases too, osteoporosis is also in the you need to be active and stop doing all those bad things for bones.
Very interesting. We have Louise on the line from Johannesburg. Let's take Louise. Louise, welcome.
Hi, good morning.
Morning, Louise.
I'm good, thanks. Well, I can't say I'm good. Okay, I was born with congenital hip dysplasia.
Right.
I'm 53 years old, currently suffering with severe osteoarthritis, which is affecting all the joints, like the ankles and the the shoulders, or, you know, your joints.
Yeah.
But it's got to a stage where I honestly cannot handle the pain. I've been given a very Schedule 6 medication just to ease the pain, but it's causing other complications. I can't go on like this. I'm not sure what to do.
All right.
And I would really love to get advice on how to treat this. Haven't taken, there was calcium Sanders Forte, but it's been taken off the market. So I use calcium.
Okay. Thank you very much for the question, Louise. Well, I suppose perhaps it's an indication that we need to have a separate show on arthritis.
Absolutely,
isn't that so?
yeah. Two separate entities.
Correct. Perhaps you want to just, a word or two to Louise,
Look,
just generally. Yeah.
Louise, continue with your calcium supplementation. That's good, and that's good for your osteoporosis. Unfortunately, it does sound like you're suffering from general osteoarthritis, and as we've said, that is a separate condition. Yeah. It just depends on the severity at the joints, what the actual management is.
But there's no link between
There is no link between osteoarthritis and osteoporosis.
All right. So let's go back to, before we run out of time in this segment, that issue of nutrition. What is important to keep our bones strong and healthy?
Okay, so an adequate diet, obviously adequate calories, as we said, so that you've got an adequate BMI, you're carrying enough weight. You also we need to make sure that you're getting enough calcium and vitamin D, which Teresa touched on, through your diet, and protein.
And where do people get calcium and vitamin D?
So, you look at, often our diets they're actually fairly poor in this, supplying that, and often we do need supplements, but your dairy products obviously help with your calcium. Then there are nuts that also help with calcium. Vitamin D, you do find it in your fish oils, and then there's the sunlight. But as Teresa said, we're living a sedentary lifestyle, so we're often indoors or we're covered in sunscreen, and more than not, we actually found our patients are low on vitamin D.
Yeah. I think it's on that note that we should just go on a break, because I think it links us to the question of how to prevent osteoporosis. Yes. Well, that after the break. Please stay with us.
The SABC News mobile app is your one-stop digital portal to all the news you need. Stay connected with the latest in breaking news. Watch the SABC News channel along with clips and live streams of all the big news events, and listen to all the SABC News radio stations live, including podcasts and much more. Simply download the SABC News app to your Android or iOS device from either the Play Store or the App Store. SABC News, independent, impartial.
The women and the children of this great country are under siege.
I can hear the cries of women in the streets.
Women are dying with protection orders in their homes.
Women face the onslaught of an oppressor with a different face.
The scourge of violence against women is a dark stain in our nation.
I stand here today and I think of Valencia Farmer. I think of Uyinene. I think of Jesse Hess.
There must be harsher punishment for rape.
We've been mourning, we've been sympathizing with the women that were raped in our country.
Gender-based violence has reached extreme levels which can no longer be tolerated.
Don't strike your sisters. They are the mothers of tomorrow.
Our mothers have cried, our sisters have cried, our daughters have cried, and we are saying enough is enough.
My name is Sergeant Major Conaway. I choose yellow as a sign that I'm feeling opportunistic towards South Africa.
My name is Kasaundorana, and I'm from Ethiopia, Addis Ababa. I came to South Africa in 2001. I'm going to give the political landscape and system of South Africa a grade, because we are still the best in the continent.
Ik wil worden aquí voor die land dat moet recht komen nog.
Out of these three,
I choose red. Our government is under danger. Corruption, unemployment, youth unemployment, water crisis. We are in trouble.
Welcome back, and thank you so much for staying with us. We're discussing the hot topic of osteoporosis, which I must also add is completely different from arthritis. But yeah, we have our experts here, Dr. Hayley de Wet, who's sharing her expertise with us. And of course, we still have Teresa Ho from Cape Town studios, who's the CEO of the Osteoporosis Foundation of South Africa. Okay, so let's talk screening. How do people, I mean, we spoke earlier about the fact that this is a silent,
Yes.
condition, and therefore there's some element of screening, perhaps, that people may argue is necessary. Just tell us a bit about screening.
So generally we advise that all women over the age of 60 should be screened, and by screening we mean usually with the bone mineral density. So it's a type of scan, very low radiation, much lower than an x-ray, that gives us an idea of the integrity of your bone.
So it's interesting that you say over 60, not 50.
So it's not to say that you shouldn't be screened younger than 60, and that depends on your risk factors, and that's where your doctor should be looking at you in terms of your complete fracture risk profile. They say over 60 because we also have to look at the cost-benefit ratios, and we can't just screen everybody.
Well, talk about cost. I mean, it costs something to go through some, the scan. How much does it cost, by the way?
It's roughly around 2,000 Rand in the private sector to get a scan. So that is a barrier for our patients to actually be screened.
Right. I just want to cross over to Teresa and ask her, to comment on the screening. But first, let's take Anonymous from Johannesburg. Anonymous, welcome.
Good morning to you. Thanks for taking my call.
Yeah.
I am 75 years old.
Yes.
I don't know if I've got osteoporosis or do I have arthritis. Because I was 18 years old and I was diagnosed with rheumatic right through my joints, all my joints, my body. I was swollen. I couldn't walk for 3 years.
Right.
And after 21, I started working. I was only working till about 40.
Right.
42. Then it starts again because then I could not do things.
Okay.
Now I'm 75 and my joints are all skewed. My fingers are crooked. My legs are swollen by the knees. It's like knobs on my knees. It's like out. My toes are paining. All my ankles, my whole, now starting with my back, my spine, and my hips.
Okay.
And I fall, but I don't fall. Like when I walk sometimes, and my legs just give in, and I must hold on to something.
All right.
Else I will fall. But I've never had a broken leg or nothing.
Okay.
Because I've been falling so many times, but I've never had any broken bones.
All
My
right.
bones are
Anonymous,
very strong.
Thank you so much, and let's see if we can address your question. Well, to her credit, she's 75 years old. It sounds like she's got some form of arthritis, disabling arthritis. But she mentioned the spine, that she's also, getting a bit of a crooked spine, I think, in her own words, yeah?
Yeah, so interestingly, a lot of the vertebral fractures, so your spine fractures or breaks in layman's term of your actual vertebra in your spine, are often undetected. And sometimes you don't know, they just happen and we pick them up on screening. Or you start to have that hunchback or that dowager's hump, or you might just have some insidious pain. So that's where we pick that up with screening. Perhaps she should. However, she could also have arthritis of the spine. So that's a bit of a tricky one. Good sign that she hasn't broken anything with all her falls.
Great stuff. Teresa, let's talk to you now in Cape Town, and just your comments around screening before we talk about prevention.
I think I'm just going to reiterate what Hayley said. Routine screening is not cost effective, but I urge everyone to go and have a look at their possible risk factors, and they can obviously visit the NOFSA website for a more detailed one. And I think we've touched on a few of the chronic diseases and long-term medication of or glucocorticoid use, anti-epileptic medication. So routine assessments not cost effective, but if you know your risk factors, doesn't matter what age you are, you can actually take those to your doctor too and ask to be screened for osteoporosis.
Okay, all right. Let's take Maria from the Free State. Maria, welcome.
Thank you so much. Good morning.
Morning, Maria.
Yes, I had osteoporosis in my right hip.
Right.
And I'm working with a crutch.
Right.
So now 2 weeks back, I feel pain in my left hip also, and deep in my left hip, it feels that there's something loose inside there.
All right.
So at the moment, it's very difficult for me to work. I had pain during the day, in the evenings. I can't sleep well. I had pain in my knees. So I want to know what can I eat or what must I eat? Because I felt when I was still working, I felt at work, and the doctor said that my spine also was affected. But at that moment, I did not have osteoporosis. But now it's difficult for me, even my back, when I can't do nothing. I'm just sitting during the day, and my hands also, my fingers is also tense.
All
But
right.
the worst thing is my knees and my hips. I don't know what to do at the moment
All
because
right.
I'm drinking treatment. I'm using treatment, but I feel pain all the time.
All right.
Thank you
Thanks
so
for your
much,
call,
Doctor.
Maria. Maria has been diagnosed with osteoporosis. I'm not sure whether or not she had a hip replacement, but she's starting to feel pain and so on.
To me, it's still not clear if she really been diagnosed with osteoporosis, just because of her symptoms with the knees and the hips sounds more like arthritis. You know, as we said before, with osteoporosis, you're symptomatic if you break the hip, which then would be surgery. It's not really just pains in the joints so much.
All right. Okay. So perhaps she must just continue her treatment and her diet as we advised.
Diet as we've said.
And she must perhaps, consult her doctor.
Yeah,
or the
maybe
local
just
clinic.
to clear that up.
Yeah. All right. So let's talk, prevention now. And perhaps focus on, we've touched on the issue of diet. Let's talk physical activity. And what type of physical activity? Somebody was talking about the difference between weight-bearing exercises and non-weight-bearing exercises.
Okay.
Perhaps you want to take us through that?
So weight-bearing exercise, and that's actually your own body weight, so even walking itself is a weight-bearing exercise, stimulates bone formation. So very important that we get off the couch, we get out there and we move, and that actually helps our bones renew themselves, as we mentioned earlier. In terms of non-weight-bearing exercises, for our osteoporosis patients, we also ask them to exercise their muscles in terms of their core muscles, their quads, so that they improve their balance. And that's very important because then they're less likely to fall.
Right.
So it's exercise to stimulate the bones, and it's also exercise to make you safer.
So both of them, actually.
Both of them are important.
All right. Let's take Thabo from Bloemfontein. Thabo, welcome.
Good day, how are you?
We're good. How are you, Thabo?
I'm fine, thanks.
Mm-hmm. Your question, please.
Yeah, my question is basically, I want to know if KFC is still offering the streetwise 2 pieces.
Say that again?
Where you pay for 34 rands, or I'm asking, does KFC still offer that streetwise 2 pieces where you get 2 pieces of chips?
I think you have a wrong line. You come through to the wrong place. All right. Let's just come back. I'm not sure why we're getting calls about KFC. Teresa, could it be perhaps something to do with you?
Maybe chickens are cured, we don't know about.
No, I don't think we're advertising KFC on the website as a cure for osteoporosis, no.
Yeah. Anyway, perhaps just your last few words are just around prevention and lifestyle issues. We spoke a little bit about the exercise, yeah?
Are you talking to me now, Sarah?
Correct.
Yes, exercise. What we're saying is we don't want you to really go and start a marathon. So as Hayley said, weight-bearing exercise like walking, jogging, dancing. Low impact, which is a better option because it's not as bad for the joints.
Right.
So any exercise where you bear your own weight is good, and obviously core strengthening exercises, as you said, to prevent you from falling. If you want to know more about those exercises, we have many videos and video clips on exercises on the website.
All right. Okay, we're going to give out the details of the website just in a few minutes if we haven't done so already. But please, we don't advertise streetwise and stuff like that. Time for another break. When we come back, we'll wrap up our discussion on osteoporosis. But before that, just some tweets that we need to go through. We just need to get them on the screen up as soon as we can. And yeah, Mbakasi says, being more active can help you lower your blood pressure, boost your levels of good cholesterol, improve blood flow or circulation, keep your weight under control, prevent bone loss that can lead to osteoporosis. Very true. And the next one is from Health and Fitness Tips, says, don't be scared of weights. Weight training is very important to strengthen bones as we get older. It's proven to stave off or even curb osteoporosis. Don't be afraid to try your hand at weights. Just start slow and light work your way up. Okay, and we have a last one. Inspire Pilates. When a sneeze can break your bones, that's osteoporosis. Osteoporosis Day, done correctly, Pilates exercises can help people with weakened bones by increasing bone density, increasing strength and muscle mass, and improve balance, which can help prevent falls. Very good. Okay, time for another quick break. When we come back, we wrap up our discussion. Please stay with us.
The women and the children of this great country are under siege.
I can hear the cries of women in the streets.
Women are dying with protection orders in their homes.
Women face the onslaught of an oppressor with a different face.
The scourge of violence against women is a dark stain in our nation.
I stand here today and I think of Valencia Farmer. I think of Uyinene. I think of Jesse Hess.
There must be harsher punishment for rape.
We've been mourning, we've been sympathizing with the women that were raped in our country.
Gender-based violence has reached extreme levels which can no longer be tolerated.
Don't strike your sisters. They are the mothers of tomorrow.
Our mothers have cried, our sisters have cried, our daughters have cried, and we are saying enough is enough.
Many often share their worry about artificial intelligence taking their jobs away. The truth of the matter is that artificial intelligence does a lot of things faster and better than humans.
That machine didn't make itself, it was made by a human being. So which means us as human beings, we need to think more on the skills which we have.
I feel like ultimately it'll increase productivity and efficiency of things.
There's a lot of apprehension from the staff. The staff is really worried. What's going to happen? Am I going to lose my job? Is machines going to take over the world? The reality of the matter is, though, that the future is a blend of humans.
I don't like the sound of it too much. The fourth industrial,
On Network every Sunday at 8:30 p.m.
Welcome back. So we're now going to learn about how osteoporosis is treated and how people with osteoporosis are supported. And perhaps the most important aspect for this show is how we prevent falls and fractures. Let's come back to you, Dr. Edivette. Perhaps just the general principles around treatment without spending too much time
Yeah,
on
I won't go into too much detail because that is quite scientific. But obviously, we've spoken about a lot of the lifestyle things, which we'll get to again, which are important. When you look at the actual medical treatment, just to say there is good treatment out there that's been available for a long time. It can reduce your fracture risk by up to 40 to 50%, so really effective. It is available. It is obviously also, again, there's a cost with it, so that's where our patients do find difficulty, but there is treatment out there, so they shouldn't feel that it's a hopeless case and it's a death sentence. It isn't.
All right. Let's cross to Teresa. Teresa, in terms of the support that you give now as a foundation now, you obviously have, a whole lot of people with osteoporosis. Just what sort of support do you give them?
Well, we have a helpline where we answer patient questions. We also answer it from the website. What we do have is a service where if they have osteoporosis or have been diagnosed with osteoporosis, we have a list of doctors in their area so that they can be referred to the right doctors who can treat or who are interested in treating osteoporosis. Obviously, information-wise, we have monthly blogs on specific topics on osteoporosis, and I've just been listening to all the patients phoning in. The misconception, just because they hear osteo in front of a word doesn't mean it's osteoporosis. So we have some articles on that, just explaining the difference between osteoporosis and osteoarthritis very nicely. Also dealing with all the risk factors like eating disorders, all the other chronic diseases causing osteoporosis, dealing with risk factors. So information is, I think, key to educating patients and sending them to the right people. So all that information they can find on the website in terms of support with regards to information. That's what we provide to patients.
So linked to the issue of nutrition is the whole issue of supplements. I mean, this is a big industry, and there's all sorts of supplements available out there. Do you perhaps give people guidance in terms of what they should be taking, if they should be taking any of these supplements at all?
Well, obviously, firstly, we say that they should get their calcium. They should try and get their calcium in their diet, and we recommend about 1,000 milligrams of calcium per day. So we know that more than half of people never get to that in their diet, so that a supplement is necessary. And I always say there is no best supplement for a patient. The one that suits your pocket, doesn't make you feel bloated, and is okay absorbed by you, that's the correct one for you. And as you said, there's such a myriad of calcium supplements out there. Talk to your pharmacist about something that will suit you. And you might it might not be the first one, but it's a trial and error thing with regards to supplements.
All right, okay. So Dr. De Wet, that one very important aspect, preventing falls. I think it's we may park the issue of treatment for a while, but let's just talk about how we prevent falls in people with osteoporosis.
I think what I first want to say is the weak bone coupled with the fall is what creates the fracture.
Right.
So just treating the weak bone and neglecting the fall is not good enough. And even if perhaps you can't afford the osteoporosis medication, you can try and prevent the fall. And falls, there's some simple practical things people can do. We've spoken about exercise, so that is important. That improves balance. If balance is really poor, if you've got supervised core strengthening exercise, that's great. There are other things that can also be causing falls. So perhaps granny's taking a sleeping tablet. That needs to be looked at. She's groggy at night, a fall happens in the bathroom. Perhaps we're overdoing the alcohol, which we've said already is bad for the bones and also can cause the fall. Just having a look at all the medications, if you ask the doctor to look at them with a view to falling, you may find that one of the medications are causing the balance to be poor.
Yeah. And what about, doing some sort of risk assessment around the home, especially with grannies that live by themselves, looking around for things that might cause...
Tripping hazards. Very important, as I mentioned, at night, a nice clear route to the bathroom, a simple thing like that can actually make a difference. Never rushing, getting up and rushing off to answer the telephone or something like that, taking your time. And if you are falling, just someone identifies the fact that you are falling and has a look at Perhaps why, and what can we do? That eyesight is an important thing. Are the spectacles appropriate? Often we find that the multifocals are not appropriate and they can cause falls as well.
All right. I'm going to cross to Teresa before we run out of time, just to give you the last word. You know, what is it that you want to say to the public and to all those that may or may not have osteoporosis? Your last word?
Well, I think I'm speaking here purely for the patient. So then they need to make as much noise about this very silent disease as possible. And we urge patients to really come forward with their stories. Because in terms of lobbying for patient right, we need patients to lobby with us for that. And just keep on looking after your bones.
All right. Well, Teresa Ho, CEO of the National Osteoporosis Foundation of South Africa, we thank you so much for your contribution.
Thank you so much, Thelo.
All right. And perhaps before we say goodbye, your last word?
Just again, to bring it out of obscurity, a quick little fact or number. Broken bones from osteoporosis in women are more common than breast cancer, heart disease or stroke combined. So if you just think of that, it's common, it's out there. As doctors and as the public, we need to be aware of it. And as Teresa says, make as much noise so that we can actually prevent it. And what we're looking at is quality of life for all in the future.
Absolutely. Well, Dr. Hayley de Wet, osteoporosis specialist and specialist physician based at Donald Gordon, thank you so much for your contribution. And I'm sure we've learned a lot from you today. And to you folk at home, thank you so much for watching. We're back with you again in a week's time on SABC. I'm Dr. Sulamoto. Until next time, please do take care.
The women and the children of this great country are under siege.
I can hear the cries of women in the streets.
Women are dying with protection orders in their homes.
Women face the onslaught of an oppressor with a different face.
The scourge of violence against women is a dark stain in our nation.
I stand here today and I think of Valencia Farmer. I think of Uyinene. I think of Jesse Hess.
There must be harsher punishment for rape.
We've been mourning, we've been sympathizing with the women that were raped in our country.
Gender-based violence has reached extreme levels which can no longer be tolerated.
Don't strike your sisters. They are the mothers of tomorrow.
Our mothers have cried, our sisters have cried, our daughters have cried, and we are saying enough is enough.
Welcome to Media Monitor. This is where we take a look inside the world of media, analysing the trends and the issues and the reporting of some of the week's top stories. A shocking report states that 51% of South Africans don't trust the news.
The trust levels in independent media have also come from media getting it wrong very often.
Does this mean that our journalists are not credible enough?
We got investigating journalists in South Africa, the best.